So welcome to Salt Lake City, and thank you for attending this Global Surgery Conference presented by the Center for Global Surgery at the University of Utah. As you know better than I, there is just a tremendous need for surgery to save lives and to improve the quality of lives of billions of people in many, many parts of the world that are underserved. There are a myriad of reasons for these needs and the challenges, including the cost, the infrastructure, and probably the most important, the crippling shortages of trained individuals across the world. Addressing these issues will require a multidisciplinary approach, collaborative approach, and certainly a tremendous amount of innovation, which is the focus of today's conference. We are very pleased to host this conference here at the University of Utah. We have had, I hope, recognition as being a leader in global health. I want to acknowledge the tremendous efforts of Devon Hale, together with Steve Alder, and many of the faculty and students who have really been pioneers in the areas of global health and have helped us lay our global footprint. This initiative takes us even further with that goal, and I want to personally thank Catherine DeVries. Those of you who know her can appreciate just how passionate she is about this work. Together with Ray Price, they have written really a seminal textbook in the field, and I really want to thank Catherine for her energy and for her efforts to advance this cause. We have brought together in this conference surgeons, anesthesiologists, nurses, engineers, finance people, even some administrators, and people from around the country and around the world to share their knowledge and experience to find innovative solutions that make surgery affordable and accessible across the world. I think we have a strong track record here, particularly in innovation. We have a particularly strong innovative culture here at the University of Utah. Our bridges between engineering and the health sciences have led to tremendous advances in technologies. Some of those are reflected in our industry sponsors. I just want to make a special call out to Megadyne, which is a company, one of the leaders in the electrocautery industry, well recognized for their efforts in sustainability, and also founded by a former University of Utah alumni, Marsden Blanche. Now, the discussions in the next couple of days, we hope, will provide the seeds of solutions that will eventually help people worldwide. And we hope that this is the first step of what will become an important annual conference to address global surgery needs. One of the important aspects of global health is that the solutions that we identify don't just apply to underdeveloped countries. Innovations that make surgery cheaper and more accessible to people in far-flung regions of the world, we certainly know can well be applied here in the United States as well. Now, as part of my opening remarks, I wanted to tell you a little story. And this story, I mentioned Marsden Blanche, who's one of our distinguished alums, and he was actually one of our first Dean's Roundtable guests. The Dean's Roundtable program is a program where I have invited distinguished alumni of the university come back and meet medical students and discuss with them their career paths. Well, I want to tell you a story about our next Dean's Roundtable guest for the University of Utah. And to tell you this story, I have to go back to where I just came from, NYU. So at NYU, where I worked for about 14 years, when I started there, I came to know of, although I never got to meet him, a recently retired but very distinguished and much beloved faculty member named Tom Rees. And Tom was known, for those of you who are in plastic surgery, you will all know about Tom Rees. He is really considered one of the fathers of aesthetic plastic surgery. He wrote the definitive 2-volume textbook on aesthetic plastic surgery. He trained generations of plastic surgeons all over the country, had a thriving practice in New York City, very highly regarded figure. And he was somebody who came back every year and taught our residents and was really very much beloved. So when I arrived here at the University of Utah, I was delighted to discover that Tom was actually an alum of the University of Utah. He'd grown up in Salt Lake City and had gone to the University of Utah Medical School. And it was only after he went abroad to the UK, to Queen Victoria Hospital in London, that he left the area, and then finally he settled in New York City. And when I met him and his wife, Nan, I was delighted to know that they had donated a gift, endowed chair in honor of his father, who had been a professor at the university. That's why he grew up here. And then as I met him, I came to discover an entirely different part of his life, which I had not appreciated, knowing everything that I knew about him in New York City. And a lot of that story is in this book, and I'm just going to read you just the first page of the book, because I think he tells his story better than anyone. So this is set in 1956. He's just finished his residency, and he's gone off to work with a very famous plastic surgeon in London, Sir Archie McIndoe. And he tells the story of how Archie has brought him to Africa. And so this is how his book begins. On a table in a rustic farmhouse on the slopes of Mount Kilimanjaro, a Maasai Moran warrior lay on his back quite still, teeth clenched, his handsome Nilotic face stoic but betraying pain. From an ugly rent in his belly, dark blood slowly oozed, flowing down over the sides of his body and dripping to form a dark red puddle on the table beneath him. A filthy ochre-red blanket was wrapped tightly around his body in a desperate effort to stem the bleeding and hold his guts in place inside his abdomen. The blanket now lay partially open, revealing the wound. I could see the unmistakable glisten of intestinal loops bulging through the hole in his abdominal wall. A few hours before, while driving his cattle herd to water, he had surprised a rhinoceros foraging in a thick bush. Alarmed at this intrusion into his space, the enormous beast charged, impaling the Maasai with his massive horn. The attack lasted only seconds, but the horn, a formidable weapon, had torn through his groin and pierced his abdominal cavity. Tossing him aside like a rag doll, the animal trotted away and left the man to die. But he did not die, and if I could overcome the gnawing insecurity that wrenched my own gut, he would not die now. I had never seen such a devastating wound in all of my experience in the emergency rooms of the various hospitals in which I had trained, and the clinical detachment which all surgeons learn to rely on temporarily vanished. I was young and self-confident, but my surgical training had been in modern hospitals with state-of-the-art equipment and technology. I knew that never again in my career would I be more knowledgeable, even though my skills would be continuously honed over the next few decades. In the United States, such a problem would be difficult and serious, but with every chance of success if dealt with promptly and skillfully. Here in the bush, many miles from any medical facility, with night coming on, I was apprehensive and feeling very insecure. Stripped of all the backups that I was accustomed to, how was I going to save this man's life without the support systems that I was accustomed to, without IV fluids, blood for transfusion, adequate anesthesia, and with only rudimentary instruments? And that begins his story in 1956 of how he, together with Sir Archie McIndoe and Sir Michael Wood, founded what has come to be known the African Medical and Research Foundation, AMREF, also known as the Flying Doctors of Africa. I think many of you who have done work in Africa probably have worked with this organization. Certainly we have at the University of Utah. It has gone on to become one of the foremost medical programs in Africa with an annual budget of over $80 million. And from my point of view, it sort of comes full circle to this conference. Tom Rees, a native of the University of Utah, wrote this really excellent book. I hope that intro has enticed you to read it, if you haven't read it already, called Daktari, D-A-K-T-A-R-I, A Surgeon's Adventures with the Flying Doctors of East Africa. And so with that introduction and with the thoughts of where Dr. Rees began in 1956, all the way to where we've come now, and still the challenges that we face, I welcome you here to Salt Lake City, and I look forward to a very productive and enjoyable conference. So thank you very much.